Hi, I'm Dr. Joanne C. and I'm a dermatologist from Sydney, Australia. Today I'm going to show you how easy it is to use Mal Cream with natural daylight activation for the field treatment of solar keratoses. Having been an investigator in the Mal Cream with natural daylight activation trial, I can see how easy it is to use as a field treatment rather than use it as a treatment for lesions. It's very easy, and in Australia we have lots of fair-skinned people who have a lot of sun damage. During the patient consultation, it's really important to explain to the patient why we're using Mal Cream with natural daylight activation and to compare the different treatments available and the benefits of this one. Firstly, the patient washes their face, and if you have a lady with makeup or moisturiser, it's really important to wash this off prior to the procedure. I usually take photos of the patient prior to the procedure just to let the patient know how they'll look before and after. Rather than use expensive equipment, we have elected to use microdermabrasion crystals manually. In this way, we can feel if there are any thickened lesions, which are then curetted off. After microdermabrasion or curettage, we then use an appropriate sunblock for the patient, and this is applied to the whole area that is going to be treated. After the curettage or microdermabrasion, we then apply the Mal Cream with a gloved hand. Sometimes patients will experience a transient tingling which goes away in a few seconds or minutes. The patients then go and sit outside in natural daylight. They don't have to sit in direct sun, and they shouldn't be seated behind a window or glass. After the patient's been sitting outside, they then come back into the office and we wash off the cream. The aftercare is very simple, and patients are usually instructed to use a moisturiser daily until they feel comfortable. They're told not to spend too much time in the sun, and they often send photos back to us at the office. We often ask for photos at days 1, 3 and 7, and I see the patient 3 months after. Patients often ask what can they expect with the treatment. Oftentimes immediately afterwards they're red, and then they can develop red or crusted areas where the treatment is going to work. They then can get a slight scale or flake, but this usually resolves within a week, possibly up to 2 weeks. Oftentimes they wonder what they'll look like, and I explain to them that they'll look as if they have a sunburn, often worst at day 3, but most of them improve between day 7 and 14. Patient acceptance for this treatment is very high due to the fact that it is very easy to treat, it's quick, relatively painless, and that aftercare is very simple. The cosmetic benefit is seen with very few recurrence of keratoses. This is an innovative treatment for field treatment of keratoses. When using Mal Cream and natural daylight activation, we have the benefit of treating not only the keratoses we can see and feel, but also subclinical disease.
Yeah, I've found the treatment process to be easy. No problems, no drama, more like a facial than anything else. No pain in fact. A little bit of tingling, and that's about it. Outside was really no different from just being outside normally. Just sat around and let the thing do its natural, whatever it does. I've been treated in the past and used creams, but found them to be just a bit difficult because you have to apply them twice a day, then you have to remember to do it day and night, and just found it all a bit difficult to remember to do it and for the results to take place. It's just difficult.
In summary, this is a really easy treatment, both for the dermatologist and for the patient. For the dermatologist, the procedure is easy and there is very little that is needed. No fancy machines, no lasers. For the patient, it's easy too, because it's all done in one day. Short-term maintenance is easy, all they use is a moisturiser, and long-term benefit is sustained, both with regards to treatment of keratoses and also cosmetic benefit.